Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives. WHO is on the ground, working with the affected countries and others at risk through our country and regional offices, as well as with partners including the Africa CDC, NGOs, civil society, and more. For example, we're providing missions to analyze blood samples and confirm cases of Mpox. We're supporting laboratories to sequence viral samples. We're on the ground supporting case investigation and contact tracing, risk communication, and community engagement. We're training health workers and supporting clinicians to provide appropriate care. We're supporting countries to access vaccines and develop the strategies to roll them out, and much more. WHO is committed in the days and weeks ahead to coordinate the global response, working closely with each of the affected countries and leveraging our on-the-ground presence to prevent transmission, treat those infected, and save lives.
On August 14, 2024, the World Health Organization declared Mpox, previously known as Monkeypox, a global health emergency due to a surge in the cases across Africa. This announcement came after a meeting of the UN Health Agency's Emergency Committee. Now, in the latest update, the virus has been detected in Pakistan as well, with 3 patients found to have Mpox virus. Originally identified over 50 years ago in the Democratic Republic of Congo, Mpox has been epidemic in the region for decades. Recently, a new variant of clade 1 strain known as clade 1b has emerged and is spreading in eastern Congo and neighboring countries that previously had no cases. Swedish authorities reported case of the clade 1 variant on Thursday on 15th of August, marking the first detection of this strain outside Africa. Despite this, they have assessed the public risk as low. Now let's understand what Mpox disease is, the symptoms and how they spread. Well, Mpox is a viral illness caused by the Monkeypox virus, which belongs to the Orthopox virus genus. It primarily affects humans and animals. The virus was first detected by scientists in 1958 during the outbreak of a pox-like illness in monkeys. Historically, human cases have predominantly been reported in Central and West Africa, particularly among individuals who had close contact with infected animals. The first reported human case was a 9-month-old baby in the Democratic Republic of Congo in the year 1970. Moving forward, let's talk about the symptoms. Mpox shares its viral family with smallpox but generally causes milder symptoms. Infected individuals typically develop a rash that can appear on various parts of the body, including the hands, feet, chest, face, mouth or genital areas. This rash evolves into pustules that are large pus filled with pimples, which eventually form scabs and heal. Additional symptoms may include fever, headache, muscle aches and swollen lymph nodes. Symptoms of Mpox start within 1 to 21 days of exposure and last till 2 to 4 weeks. Although rare, Mpox can lead to severe complications and in some cases can be fatal. Now, how does this virus transmit? The Mpox virus is transmitted to humans through close contact with an infected animal or person. It spreads through several modes like direct skin-to-skin contact, contact with saliva or respiratory secretions, contact with bodily fluids or lesions, especially around the genital areas, prolonged face-to-face interactions such as talking or breathing, contact with contaminated objects, fabrics and surfaces. Pregnant women can transmit the virus to their fetus during pregnancy or to their newborn during and after birth. The virus enters the body through broken skin, the respiratory tract and mucous membranes. Now let's talk about the precautions for the same. Mpox can be prevented through vaccines. As the Mpox virus and the smallpox viruses are related, smallpox vaccines can offer protection against Mpox. Other forms of prevention include decreasing human contact with infected animals and limiting person-to-person spread. According to WHO, there have been over 14,000 Mpox cases and 524 deaths in Africa this year, with the vast majority of deaths occurring in Congo. Despite the serious nature of the outbreak, the WHO has not classified Mpox as a pandemic. The disease has recently spread to Rwanda and Burundi, which share borders with Congo, and has also been reported in Kenya and Uganda. The WHO declared Mpox a global health emergency in July 2022 as well, when the virus was first found to spread through sexual contact and was reported in more than 70 countries across the world. Once cases declined, the WHO lifted the emergency status in May 2023. While the 2022 outbreak was driven by clade 2 of Mpox, the current outbreak is being fueled by clade 1, which can be more deadly. The global health community remains vigilant, monitoring the situation closely and taking steps to prevent further spread of the virus.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.